meron ng medisina, antibody ang isang giant pharmaceuticals. Tapos naghahabulan sila. Sabi, by May, baka they would start to market it. Pabili na nila. Ang problema, sabi nga ni, we are on the last ladder. Ang muna niyan yung mga mayaman na, kasi marami yan kailangan. So as fast as they can really manufacture or farm out the product, just retain the copyright para magtulungan sila. Kung meron na yan, tapos makita ko na ginagamit ng tao, ililift ko. Total, kung magkasakit kayo, may antibodies naman tayo mabili. Ngayon, kung wala kang mabili, problema mo na yan. Kasi tapos na yung, I will lift the quarantine. Ngayon, paglabas ninyo, ganun pa man, I would still insist. Kasi sabi ng mga scientists dito, kinig ako. Hindi yung scientist sa TV yung sasalita na personal. Sekreto, ganun pa man. Mask, yung, ano yung akin? Ito. Ganito. Mask. Alcohol. Pati maghugas. Hindi na yung sabon na ordinaryo. Basta soap and water. Okay na yan. Alam mo, pag nagsama lang tayo, kaya natin ito. Kunting panahon na lang. Alam ko, igit na kayo na makalabas. Pag lumabas lang itong antibody na gawa nila sa labas, parang inumin mo, parang kung baga sa bakterya pa, antibiotic, sisirain niya. Kasi itong, huwag na. Para mapagsabihin, mga scientist pa ako. The nature of a COVID, gusto ko sanang, baka sabihin ninyo, bakit di ka naman doktor? Bahala na ng mga doktor mag-explain. So I will start with Joey. Kasi ngayon, ang pinaka-burning issue, yung middle class ba, yung mga MSME, after that, Sunny will Joey, mauna ka, then Sunny will give his piece or...
Mr. President.
Mukhang kayo lang man ang dalawa ang ano na dito. I'd like to ask the presidential spokesman to listen so that you can formulate a very coherent.
Thank you very much, Mr. President. First of all, thank you for, again, being very decisive and protecting the Filipino people against this COVID. I had a meeting with the World Bank a few days ago, and they said that your decisiveness in first reducing the number of people coming into the Philippines in February, and then in March, followed up by the lockdown, probably has saved 100,000 lives in the Philippines. So again, thank you for being so decisive. This is the trade. This is the real trade-off. How many people are going to get sick and how many people are going to die? So I said this is just the first pass. It took us 2 weeks to get this thing done. I asked the private sector to do it because they have actuaries, they have access to data, but they have not come out with it. So I'm not saying this is the final. I'm just saying this is the beginning of a discussion.
I would advise the checkpoints not to be dismantled, especially by the police, but this is my order. Do not stop motor vehicles carrying food and other vegetables from the province. Wave them through and do not delay their journey because people are waiting for the supplies. Second is that there is a kind of a raucous now regarding the procurement of the PCR testing kits of 900 people. Essential kits and other kits, inactivation supplies, PRC consumables, 7 PRC machines, 10 automated extracting machine, and 10 biomedical freezer, additional equipment for subnational and regional testing laboratories. Kasi itong ano dito, when you use public funds on anything that's medical or medicine, you want to have the health assessment. I think it comes from the Department of Health. But unfortunately, until now, they're still debating on the efficacy of the rapid test we would like to buy. Alam mo, there is no FDA ruling yet because they cannot act on it without the assessment, health assessment of maybe the entire country before they would act on it, ang FDA, which I can understand. But yung assessment na galing sa DOH or a section of that department handling the assessment of the entire health spectrum, it's been there and nobody seems would like to act on it with in a jiffy. Parang ano pa sila, dalaw-dalawang isip. And there's a rule that we cannot use public funds to buy medical supplies, medicines, without the FDA signal. So there's a hostage yung mga rapid tests we would like to buy. I will take the risk. I will order the health department and everybody. In the meantime, private sector is doing it. Maybe we can take over someday or do it all together with your help. I am clearing the way by ordering the purchase. Total, walang FDA local. But what we are trying to buy outside is approved by the FDA United States of America. So in a sense that almost all of what we eat, buy products of all sorts, pagka meron ng FDA approved, there's in the box FDA and galing America, kumpante naman tayo niyan. As a matter of fact, I do not really believe that they would do more testing. Ganun lang yan. So, pagka walang yung assessment galing doon sa baba sa DOH, hindi natin mabili. I'm clearing the way. I will ask Secretary Duque to talk to the people in charge, si Secretary Galvez. And they can proceed to buy it immediately, as fast as you can really do the procurement at this time. Take note of the fact that we are all in this, the entire world. We might not have the supply. And also my fear that kung nandyan yung antibody, of course, the rich nations will get it first before we can. And that I placed a condition there na kung nandyan na yung antibody available na sa market dito and that's being sold in quantity, in numbers, then I'm inclined to maybe at that time lift the lockdown. Well, I said, you can go ahead and buy it immediately. You have my clearance. Okay. So there you are. Sana na napaintindi ko sa mga kababayan natin kung ano ang ginagawa natin and what are the things that we intend to do in the future. This corona is it's a wild card sa health ng tao. So we do not know how this will end, when, but for lack of a better way of protecting the people, that is except by asking you to go inside your houses with my assurance that when the antibody that's being, I said, it has passed the medical tests o yung clinical test nila, it's ready to be sold by May. Kung makita ko nandyan at magkaroon tayo ng supply, then I am ready to lift. Kasi wala talagang vaccine. It might come, it might not. But itong antibody, which has been manufactured outside of the human body, parang killer ito na just like the antibiotic. Talagang bibirahin niya yung bacteria. Ito naman yung virus, yung katawan lang natin. But for whatever it is really worth, we have to thank these guys for coming up, and whether the efficacy is really sort of hangs in the balance. But with the assurance that they have tested it medically, I am sure that we're able to come up with something, buy it, and if I think that it is really there for good and can help people, then I am ready, I said, to lift the lockdown. Rolly, as wala ka namang problema, Rol. Everything is smooth. I said, the middle class, your patience, yung hindi nakakain, I give it to the barangay captains and the mayors to supervise and look for those guys who are there in the periphery of the barangay, not exactly inside, and that is why maybe they were not included in the listing. Look for those guys in the periphery or distancia. Sometimes you have to walk about 5 or 10, not really 10, 5 or about 2 kilometers sa bukid. That is the average between one house to another. We have to reach out to them, and this can only be done if the mayor, municipal or city orders it, and the barangay captains follow the order. Then we would have shortened everything, as explained by Mr. Concepcion, Joey. Things might go all right for this country. So I'd like to thank everybody, and if you still have some, let me see, itong dagdag, they come in. All that I ask is that you wear a mask, one that's durable, one that is, hindi yung laylay, ay yung iba nakasabit na lang dyan sa ilong ninyo. It is not sealed, hindi mo well, at least itong paggamit nito, Ano mo, sabi ni ito, as demonstrated by Dr. Dominguez kanina, ganun mo, parang naisisilyado mo. So, hindi magpasok yung ano. Higpitan mo lang konti dito. And be sure to, matanong ko muna, do we have enough masks for the entire country?
Sir, the Indian community and also with the Indian chamber just bought 6 million masks. And I believe when they donated to us 150,000 masks, they are planning to buy it again to China. So they already distributed it.
Yeah, see, Rex Daniari is planning to bring, he bought 2 planes. He's looking at bringing another plane.
I don't know if I have to say this, but I have a sort of a note from President Xi Jinping expressing his full support for us at this time and citing what we did to help China and, of course, to erase not really erase, but to counter the malign that they were suffering at this stage. Hindi naman lang kasalanan galing yung who would really want to invent a microbe to kill humankind, pati yung iyo. So he says that they're ready, and I would like to thank President Xi Jinping for his support. At kung galing lang China, wala kayong problema. I think we can have the priority anytime. It's in the other countries producing the antibody. But if China catches up with them, the okay na, then maybe a miracle will happen and civilization is back on its feet. That is how I see it. So, mga kababayan ko, ginawa namin lahat ito. One is that I really do not want to see a single Filipino dying of, lalo na yung mga bata. So, again, at the risk of being redundant or repetitious, again, I would like to say that go out and seek the hungry before they die. And for itong mga, actually, I do not know if it's still applicable. It's a poor man's standard. Nobody should be offended by this because that is what we have been using even in our speeches in public. Alam mo kasi, unfairly though, I don't know if it is the classification still good, pero ang ating society, in terms of wealth or what's the capacity to hold the money, ang number one is the class A, group A, which are really the billionaires, the Ayalas and all of them. Good for them. And the second is class B, still the millionaires, but not as rich and not as powerful as class A. Then we have the C, class C. I don't know if this holds, if this will hold true until now. Ang class A, yun yung mga mayaman na nakapagbili kung kotse, bago, bahay. Ang class D, you have to divide this. Upper D, yung may mga trabaho at wala masyadong utang. At ito namang lower, class D, lower. Dalawa yan, division, na kailangan talaga ng tulong. At yung nagbabayad, I said that it was Governor Remulla who suggested it first. It was just also a prayer to government na this group or this class of people should be looked into and receive assistance. So I said we study and we might be able to produce the money. Sunny is doing his best, and I said, ang ano lang is we can still borrow, but pag wala na, then we start to, kung ano yung mga bagay-bagay natin. Kaya nga meron kang ano dyan, to save for the rainy day. I mean, everything is almost gone, and there is nowhere a source that you can find. We can always start selling the properties. Yung sino yung makabili ng cultural center, parang palasyo yan. Pwede mong gawing palasyo, nandiyan ka sa trono. Then, marami yan. The whole of Dewi Boulevard, marami tayong lupa dyan. And it's itong the peripheral lands around PICC, pati yung cultural center. So, yan ang sinasabi ko. Ang problema is wala pang vaccine. That should be the number one cure, actually. But there's a glimmer of hope dito sa mga medisinang nagawa ng mga pharmaceuticals. Again, I repeat, ito yung antibody. It is not a vaccine because hindi naman ito kinuha ng tao. I really do not know. Might, pero little lumalabas doon sa data na binibigay dyan sa mga media outlets. Pero pag nandyan na yan, at siguro na tayo. So with that, I'd like to thank everybody. Still, my salute, my snappy salute goes to the health workers, mga doctor, nurses, and we will protect you. We will find a way of, pagkagabi na, and you are still far away from your home, kasi hindi naman you are not delivered or conveyed hanggang hagdanan. So ito lang magawa ko sa lahat. If you are still about a kilometer away, na malayo ka, at may makita ka ng pulis, parahin mo. Tumingin ka dyan sa gitna, at sabihin mo sa pulis, magpahatid ka. So, the PNP is put on notice that kung yung mga ganon, hindi naman standard, there are few public motor vehicles running, at saka yung may mga franchises, most of them are also inside their houses or has taken off for a vacation. So, the police should come in. Yung mga health workers, may card man yan na naglaklakad, tanungin ninyo kung kaano siya kalayo, at pasakayin ninyo. Give them a lift and deliver them to the house. Galing terminal, hindi naman deliver yan tao por tao sa bahay. Bababa sa terminal, and if you feel that you have to walk, you really have to walk. And if you feel tired or just want to go easy, you flag down any police, military or police. And my order is this, give them a lift. Tumulong kayo sa kapwa-tao natin. These guys are important in our fight because without them, all is lost. So again, I ask for everyone's cooperation. Maraming salamat po sa inyong lahat.